receiving his bachelor's in public health from the California State University, Fullerton, and currently pursuing his master's in public health at the California State University, Northridge. Ladies and gentlemen, give it up for the Jared Brown.
Hey. Yeah.
How you feeling, Jared? Also, my fellow intern,
Good.
give it up.
Yeah, what's up, Nate? What's
All
up?
right,
What's up, fellow
how we
intern?
doing, Jared? How you doing?
I'm good. I'm good. I can't complain.
Yeah,
It's nice, nice outside right now on the West Coast here. So,
that's what's up. Got it's still sunny out there right now. The sun's still
yeah,
up.
sunny Southern California, Los Angeles. It's June.
Yeah,
I like the weather here, so, it's real different out here on the West Coast. We like to have a good time. We keep it fun. Um, but I think my heart might soon belong on the East Coast. I don't know. We'll see after my masters.
East Coast. Oh snap! A little East Coast West Coast rivalry going on. Are you born and raised in SoCal?
No, so I'm actually originally from the Sacramento area. So I was born and raised, grew up in Sacramento. I came down here to Cal State Fullerton, like you said, for my undergrad. So much fun. Learned a lot. Got really involved with Michelle Wood and um, Dr. Michelle Wood, sorry, Dr. Akchana McElligott, and amazing other people at that campus that grew my love for this like profession. So
That's very nice. Hey, we got North Cal, South Cal, not potentially East Coast. You're gonna be everywhere, Jared. That's what's up. But let's get straight into it. Let's we're kind of like dipping our toes into it. But could you just tell us a little bit more about yourself and like kind of how you got started on your public health journey?
yeah. That's a good question. For me, I I think like a lot of people, I fell into this spirit like initially. I went to so like when I went to undergrad, I initially had went for my like bachelor's of kinesiology, and it's because I was interested in going to physical therapy school. I had had like my own like sports injuries. I grew up playing sports a lot, and I grew up just like knowing to always be active. And I had a really nice physical therapist when I was rehabbing from like my own injuries, and so I was doing that. It was cool, and it wasn't until like I got into college fully, like more in my second year, where I started to think of like public health as a field, and most of my experiences since then have been just within the wellness realm. Currently, I go to California State University Northridge, go Matadors. I am currently working as like a graduate student research assistant, and most of my like work and my research kind of revolves around a lot of the topics that are really personal to me, and a lot of the topics that I find really personal to me, those are things that I kind of fell into in undergrad. And then I guess now I'll say like my my biggest reason for why this field, there's this concept of like there's no I in team, but I like to say that there's this concept of there is a you and an I in public health. And it kind of symbolizes this idea that like public health is something not only for the public that is interested in improving their health and health as a right, but also the I kind of comes more so as like the public health professionals and like holding yourself to like that standard when working in the field, working with different communities, different things like that. And yeah, currently, like I said, I work as a graduate student assistant and researcher. I previously, when I was in undergrad, the thing that really got me into going to grad school was a National Institutes of Aging R25 training program called the Neurocognitive Aging and Analytics Research Education, or the NAIR program. And that program really set me up for A lot of great success. I had the opportunity to spend the summer at USC in 2024 under the direction of Dr. Kayan, looking at functional MRI connectivity as it relates to a potential pre-symptomatic predictor of Alzheimer's disease in the Alzheimer's Disease Neuroimaging Initiative uh, data set. And that was really fun. That was like my exposure to this field being a career for myself.
And it's been up since then. That's like your first kind of. Hey, that's what's up. It only takes one experience to really get exposed to public health and get it hooked on you, man. I
Yeah,
I can relate to that for sure, man. But
nah, definitely.
uh, I was as you're pursuing your master degree, what do you have a sort of vision for what you want to do with this degree, or what you want to do career wise after you graduate? Do you have like a niche kind of specialized yet?
Yeah, I do. I think graduate school is kind of like one of those things where you really sit down and you finally like tinker into like, okay, what am I actually interested in, and what do I want? What do I want to do within this field to make a difference? For me, that's as of lately been within like the realm of health equity. And so, like for me, I envision myself as like a future health equity researcher and biomedical researcher. When I'm done with my MPH, I'm hoping to land some form of like either a government, like research scientist job with the California Department of Public Health, or some type of job with like an R1 institution as like a staff scientist or a clinical research assistant. Long term, I am really interested in getting my PhD, and I want to get my PhD specifically in either epidemiology or health behavior research. Um, and I'm really interested in starting my own lab and becoming a professor here in the CSU specifically. It's kind of like raised me as like a mechanism. It's helped me obviously earn now 2 degrees, and so I thought I was thinking, what better way than to not give back? In about 5 years, I really do hope that if I have matriculated into a PhD program, I will have applied for like a really competitive R00 or K00 R01 grant, or some type of like T32 mechanism. These are like funding mechanisms through the NIH that are really competitive, but also really good for doctoral training. So I'm really interested in those, and working in like a health department of some sort, or working for like a state public health agency.
Hey, I don't know about you, but Dr. Brown has a nice ring to it. That's some great goals. We need more people like you representing these doctoral programs. That's what's up. Hey, but yeah, that's awesome, Jared. That's awesome. But my next question is, I mean, you kind of talked about your projects and how they are very personal to you. Uh, could you speak more to that, like the different projects that you've been working on since you've been on this public health journey? What or like I don't know, just could you speak more to the projects that you've been working on?
Yeah,
And you
this
also mentioned like a research project you're working on.
Yeah, I have some really, really cool,
Sorry.
like amazing opportunities. No, you're good. I would say I've been very fortunate enough to be in rooms with highly ranking individuals, and so it's kind of supported me on my pathway towards the different activities that I've been involved in. So when I started, I guess like my first ever research experience was like doing this summer research academy. It's called now it's at Cal State Fullerton. It's called the Path Academy. But essentially before it was called Path, it was the Allied Health Academy. And I met with a professor randomly, and we did a literature review, so really basic, on yoga psychology and psychoneuroimmunology, and the 8 yoga principles of Ayurvedic medicine. So kind of getting this really interesting small introduction to like, okay, this is just research. And it's really funny I bring that up because that same program, I'm actually going back in next month actually to lecture for their research methods and poster. Yeah, it's really cool. I'm excited. That was like my first ever thing. And then moving on is when I found like the Alzheimer's disease. And so I mentioned that like a lot of my projects I work on are personal to me. My grandmother has suffered from early onset for about the past like 10 to 12-ish years of Alzheimer's disease. And it's something that I recognize now. I'm probably not when I was younger, but it did take me a little bit of time to recognize the impact of being not only a caregiver, but the impact of the caregiver within the family unit. And this was something that got me really interested in like family systems. And so um, I took the opportunity to work with more professors in that program I mentioned earlier, the NAIR program. And I actually we were in the process of writing a paper about different factors affecting Alzheimer's disease. And so I think for me, like, and I think for anybody, like men of color are underrepresented severely in all clinical research, as well as within any type of just like research in general as it relates to the health field. And so I just kind of thought like, way better way than, me to write this paper to help myself in doing that. And so I've been doing some stuff with Nair. I also, when in undergrad, I had a wonderful opportunity to be a part of a chronic pain lab. It's called the FMCP lab at Kelsey Fullerton. Shout out Dr. Zetta Watson and Dr. Jennifer Piazza. They're great, amazing, wonderful people. They recruited me out of a different program that I didn't get into, but they let me into their lab, and it really gave me this grounded understanding of like clinical psychology with a little bit of like public mental health. Um, and I had the opportunity to actually work on a poster with a couple of graduate students and my best friend that I ended up meeting in undergrad. And now we're all in grad school. My friend is literally leaving for Yale next week. I'm really excited.
Oh man.
Um,
Wow.
yeah, so that was really fun. So I really have an affinity for working with older adults and for people who, deserve to have healthy aging and equal aging. And that kind of goes back to the whole health disparities thing. But now, as a grad student, I'm currently working on campus with our Project Rebound. So Project Rebound is like this office of student support. It supports students who are formerly incarcerated, and I think a lot of times in the public health space, we don't talk about this idea of like how incarceration can affect our health. It's not something that's always talked about, and something too in the literature. There's not really like health behavior or interventions that have been developed to help um, specifically students. So there's like correctional health and like inmate health, and like they have that in facilities, and they also have some tiny forms of programs for those who are like not on that educational path. It's more on like the career track or like certificate based. But we don't have like health behavior models, or we don't have health behavior programs that incentivize or look into incarcerated students' health, because there's so much stigma that they face. And that was also another thing that I really grew into in undergrad, was like understanding a lot of the socio-political as well as like the psychoeducational like lack of resources that go into creating those types of programs, and also like as a Black man myself, like understanding like that majority of us make up the prison or are part of the prison pipeline system, and there needs to be work and more of us speaking up and doing work to say like, hey, this area is being misaddressed when it comes to incarcerated students. So that's something I'm working on currently. I'm really excited about it. I love it. I go about probably like 15 hours a week just to um, look into really like where we can further this research at. I work with the senior coordinator, and so that's another one of my projects. And then yeah, I think that's kind of. Oh, I did a really cool thing actually. Another other thing in undergrad. I'm forgetting now, but like I should
Nah,
know
you
this.
good. You good.
I used to work for FEMA, so I used to be an intern for the Quake Heroes Expo. which is like an earthquake preparedness and emergency preparedness, disaster preparedness communications institute. And it was originally the Southern California Earthquake Center, and now it's the statewide California Earthquake Center, and that's out of the University of Southern California. It's also through USC. And I had the opportunity to kind of analyze some of that data, and kind of really find out and dive into like, okay, I wanted to see, just, working in my undergrad time, I was at very much an individualistic level of public health. And as I've grown more into the discipline, I've started to realize like my interest is more in that like macro and population health lens. And so that FEMA experience really gave me an insight into like all of public health. You don't really think about emergency preparedness or health preparedness. And it's not necessarily something that like I'm like, 120% like this is personal, but it is a project that I did that I found to be very influential on me. And I definitely can say through all these projects, I've had some of the best mentors ever. People who like truly care for me and see me for who I am, and people who want to see me succeed. And so, like, having that support system has also been integral to a lot of this like research that I have been doing. And now, as I've finished up my first year, I'm working on campus at our LGBTQ plus center called our Pride Center. And so I'm currently also in the process of co-developing, implementing, and evaluating our mentorship program. And it's based within the student development theory and minority stress model. So I'm really excited, or minority stress theory. So I'm really excited to be getting that off the ground. That's been like my latest project. Yeah, that's kind of some of the things I've been in, and um, really looking forward, hopefully, to more in the future.
Yo, Jerry, that's super inspirational, man. You so many like all those projects, so many different communities you're touching base with, whether it's healthcare and the elderly with the Alzheimer's projects and like FEMA, like all these are just so many different communities that you're touching, and it's just great work being done all around, man. It's very inspirational.
Thank you, bro.
I'm
Appreciate it.
I'm I'm, I'm
Appreciate
I'm
it.
very honored to be your fellow intern, man. This is great, man.
Yeah.
I hope to get involved in projects like this as I keep it going, man, with my public health journey. That's awesome, and I hope I don't know. Shout out to all these the mentors, man. All Jared's mentors that he's had along the way. You're really
Yeah, like
you're
I'm a
you're very impactful, man. Hello. Yo, Jared, can you hear me? Yo, can you hear me?
Can you hear me now?
Yeah, I can hear you. Can you hear me?
Oh, my fault, King. My
Nah, you
fault.
good. You good. It's gonna keep recording, so yeah, don't worry about it. We can edit that out.
Okay, cool,
Yo,
cool, cool.
this whole thing has like a whole AI editing system. Don't even trip about it.
Shit,
But
it's like high
yeah,
tech. Okay, cool, cool.
yeah, they got a nice platform right here. But I don't know. Shout out to you. Shout out to all the mentors that spent in Jared's journey along the way. You've really leaving an impact on him. He's really you. The influence that that they've had on you is really seeming to shape you into a very capable and very talented public health brother. Man, it's crazy,
Thank
man.
you, bro.
All
No,
the
bro.
impact you have.
I'm grateful for everybody that I've ever touched on. There are two people I do want to shout out if I can real quick, because
Yeah,
I
you
need that
got that.
energy. I need people to see the work that they're doing, especially because I think it's so impactful and so important. Dr. Tabashir Nabari, she is a professor of public health at Cal State Fullerton. She has done some amazing work as it relates to basic needs, specifically for students. And she was really impactful in my like last year at Cal State Fullerton. So shout out to Dr. Navari. I appreciate you. Hope you're doing well. And then I also want to shout out my OG like believer since day one, Dr. Archana McElligott. She is also a professor of public health at Cal State Fullerton, a former alumni from the UCSD SDSU JDP, so the Joint Doctoral Program. Dr. McElligott has been a moving force of inspiration for me, um, and I would not be really where I'm at today without her guidance. A lot of the people that were in that program that I mentioned earlier called NAIR. There's a lot of professors, some of them who like I have just as strong connections with Dr. McElligott, but Dr. McElligott has also done some amazing work as it relates to health disparities within cancer outcomes specifically. So if you want to check her out too, she does some amazing work as well.
Hey, salute to all the mentors, man. That's we need we need all the mentors we can get. We need all the people pouring into our community because, as you see, it's gonna pour back out into our community. All the work Jared's doing out here. So
Hell
we
yeah.
appreciate it. We love all of our mentors. We love all of our public health teachers. Just just great work being done all around, man. But let's keep it going. So we were talking. We're kind of like a high top right now. We're at the high point of the interview. A lot of good
Yeah,
stuff
yeah.
going on. A lot of exciting projects. But I don't know. Let's get a little vulnerable right now. If you're
Yeah.
with me, Jared. Uh,
Yeah.
what kind of challenges have you encountered on your public health journey right now, or thus far, that you just kind of want to speak to, or have you had any adversities so far in your journey?
Hell yeah, I have had adversity. Oh man. Um I think this is a part of like everyone's kind of growing up journey. For me, it's more or less now coming to my realization. But very frequently, I have been one of, if not the only, like man of color in the room, or like person of color in the room. Very frequently, like one of the only people in the room speaking Spanish, or one of the only people in the room who's like mixed. So I'm used to being like one out of many, and that has definitely impacted my like imposter syndrome and confidence as it relates to like just being in this profession. It's something that like now, especially that I feel like I'm getting to be a really early professional. It's something that I've not as much had to run into. But I think definitely throughout school, there's been a lot of adversity in that. Me personally, I also suffer from major depressive disorder. And so, I think I always talk about mental health to my friends. It's something that I'm really also passionate about. But like this idea that like you really can't take care of others until you take care of yourself. That was not something that like appeared to me, or like, sometimes you got to learn lessons the hard way. I had to learn my lesson a little bit of the hard way, and realizing like taking care of yourself is the most important thing you can do. I feel like, especially depending upon like how you were raised or where you live at, you got to always put what are you doing at the end of the day first. And I think it's important to always have some type of outlet, whether that's like a journal or like, anything like that along those lines. I definitely can say for myself, journaling has been one of those things that helps with my depression. And it also makes me feel like I, like have a space to express the way I might be feeling. And something else that I do kind of like to do that is dance. I'm actually a part of a hip hop dance team out here in Southern California called Baudelaire. Shout out my friend Spencer. We're a hip hop competing team. We frequently do some of the like Southern California dance shows, but dance has also been one of my like staples in my life. I've been dancing since I was like 16. It's been one of the things that's helped me like really, really like learn, not only how to control my body and like how to control how I'm feeling in the moment, but also it's given me the tools to express myself in so many different ways. So that's kind of how I guess like, my challenges have been and the things I've done to overcome them. I could definitely say if and like I have no shame in saying this either. If I can get into grad school with like a 2.7, I think a lot of people can get into grad school with a 2.7. In undergrad, I really, really, really struggled with a lot of the basic sciences and like chemistry, and I didn't do too well. And so much so to the point where I did have to kind of like take a stop a little bit from like school, reset myself, and I got the opportunity to come back and do better. And that was really, really around that same time was like the same time when I got into like the NAIR program. I had got into like the fibromyalgia lab. So, I think definitely if you're planning to pursue future education in this field, it is possible. There are people that believe in you. You can do it yourself. No, never say die, that kind of thing. I think anything is possible, regardless of like, your circumstance.
Thank you for being vulnerable with us, Jared. That let this be a lesson to anyone listening or any of the brothers in public health out there. You're not alone. I feel the same way sometimes in my classes. Feeling like the only one, or even if you're just whether it's just being the only one, or if you're just going through it mentally. Let Jared, let Jared's story. Let us just, just let us be the a lesson, or just let us be proof that there's this. You're not alone. You're just not alone.
Yeah,
we're
bro.
strong. We can
Yeah,
go.
Nate.
We'll keep
Yeah, no,
going.
we keep going. We gotta keep,
Yeah.
we keep pushing, we keep persevering. We're our ancestors' wildest dreams. I always say that. One thing for me, for certainly, is also like family and spirituality. That's kept me grounded too. Keeping grounded in my faith, and also, using my family. I think there's a lot of wisdom that we gain from our elders that can be used anytime in the current world that we're living in. So
That's
family
what's
is
up,
important,
Jared.
bro. We gotta be a family. We gotta keep going.
Yeah, we gotta stick together, man. That's what's up. But let's go back to a high point. We went down. Let's go back up. So, do you have a
Yeah,
favorite? Do you have a favorite public health moment or memory that comes to mind on your journey so far?
yeah. Favorite public health memory. Yeah, actually, I had this really cool opportunity um, whilst I was in undergrad to be a part of student government. And I think a lot of the times, like, people hear the word health policy and they go, "What is that?" They're like, "Isn't that just like regular policy?" And I say this because you can extrapolate. This experience is very extrapolated. It's easy to extricate from this experience some type of like idea of what health policy is. And for me, that was my time in Associated Students at Cal State Fullerton. I had this wonderful opportunity to be a part of like the wellness initiative at Cal State Fullerton. And so I got the chance to go into like classrooms and talk to people like students who, were saying like the community, right? Being a part of like a board of directors. That's what I was a part of. Being a part of a board of directors is a pretty big deal. And so like, especially as a student, when it comes to wellness, we really want to try to focus on what is the student voice when it comes to what we're doing within the wellness initiative. And so, yeah, a lot of my time at Cal State Fullerton for student government, I feel like introduced me to this idea of health policy. I started learning about various different campuses that have like for example CSUN, we have this really really cool thing called the Oasis. It's like a wellness center. There's massage chairs, red light therapy, chiropractor, different types of alternative and comparative medicine, Eastern medicine, Reiki. So, like, a lot of these things that we don't really think about for students specifically, like for you and me. And so, being a student, being a public health major, and then also now, like, in that time at least, having been in student government, it was learning that like how getting this to be a policy thing and getting this to pass, it's a whole ordeal. From the year I started in student government to the end, it was a lot of back and forth. I actually had the rare opportunity to really speak with also like some key stakeholders, and I think this is kind of like what got me to be like, yo, like, you know what, this public health field is cool, like this is public health, like like, I think a lot of people say public health is everything, but for me personally, like that moment, watching that like initiative get passed, to me that was like public health. And I have a really great support system, like I mentioned earlier, but somebody that I really found a lot of my like ideas from this initiative and the things I was doing. Isabel Galvan, she just recently graduated from UCLA with her master's in health policy management. I think she's a fellow now at Washington U, or I know she's a fellow at a hospital in Washington. So really shout out to her. You know, she really set the standard for what I could do in that position. And we got it through, you know. And so seeing like the research side, the okay, like I'm talking to people, and now like on the back end, you think student government, you're not doing much, but you actually are. You're trying to explain to people why should we increase, you know, the student fee to do XYZ, to have more scholarships, to build this. And that relates back into a public health framework, because when we think about the social determinants of health, we think about educational equity, right? And so equal and equitable opportunities to education, because that impacts people's health. Well, if that's not equal across the CSUs, how do we bring that into a CSU that has the largest student population, which is Cal State Fullerton? So then it kind of teaches you how to frame a policy issue, and like what it was just a really great experience for me. I didn't really have like a formal public health mentor through that, but it was something that I definitely relied on heavily as it came to, you know, working and navigating my way through the graduate school application process, which I know is coming up soon for a lot of doctoral and graduate programs.
Yeah, Dr. Brown has a nice ring to it, but President Brown, hey, all that government work, he got
I'm
my vote,
good.
man.
Thank
He got
you.
my vote. Hey, I just put it out there, man. I could use a chiropractor, you know, like my back's acting up.
Yeah, yeah, right. You know, you be sitting in a chair too long. You be in class. You know,
That's
gotta
what's up.
relax.
That sounds awesome, man. All right, so let's get to a little educational segment now. So you said public health is everything, and you have touched on a bunch of stuff already, man. But if you could just pick one topic that you think everyone should know about public health, or like one kind of public health topic or issue that you gonna speak to for all the listeners out there, uh, this is your chance to kind of like break it down for everyone, you know. And me too.
Oh.
I'm still learning a lot of stuff too, so I'll be taking notes as well. Type.
Okay, for sure. A public health topic that like a lot more people should be educated on. Man, honestly, that's really hard, dude. That's a hard one to pick.
I'm sorry about this. So, you know,
No, I know.
I asked the wrong person. This this could be a whole podcast episode in itself. Just this one question.
I'm gonna keep it really brief. I promise to keep it really brief. I think for me, a topic that I would appreciate more people being, I guess, educated on specifically is intersectionality. And this kind of falls under the realm of like social and behavioral sciences. And this idea that like as individuals we bring with ourselves, you know, so many social identities that impact and intersect the way that we, you know, think, the way we navigate the world. And very oftentimes, especially when it comes to systems of power, and as like public health professionals, I find it so important to be able to use intersectionality as the guide to develop any type of health program, a policy brief, or even like research, right? We talk about things like community-based participatory research, CBPR. That's some things I've done. I think a lot of people don't think about this idea of like intersectionality, and like how we can use intersectionality to build community, right? If we have these intersecting identities between each other, what's stopping us from working with one another across sectors within public health to advance health and to build health equity for folks? I think one of the bigger challenges with understanding and integrating intersectionality into a lot of the work that we do is that a lot of people don't take the time to continuously educate yourself on differing identities. That's not to say you're going to know everything, and that's not to say that, like, oh, if you go through every single identity and you learn something about it, then like you have the knowledge and then it's fine. And it's not like that. It's a continuously evolving thing, right? People intersect, their understanding of the world differently as it relates to their identity. And so I'm really big on this idea of like putting intersectionality and using an intersectional lens, and even we could expand that to being an intersector lens within public health. So I guess that kind of falls, like I said earlier, falls more under like the social behavioral sciences, but it's a key and critical component of a lot of the work that is done in our field, especially as it relates to cancer, different things like that, Alzheimer's disease, even too. We know if we want to talk about public health history and intersectionality, we know about and I think trigger warning for those of y'all if this is something that might trigger you, but the Tuskegee syphilis experiments on Black men, the medical mishandling of our different communities. We have the insemination of women from Puerto Rico. And these are things where when public health doesn't take an intersectional lens, it fails, right? And so we have to be able to find a way to use that intersectionality to better guide intentional, community-based programs and or different types of research based on whatever our health issue is we might be interested in looking into. Um, so yeah, that's what I wish more people would know about as it correlates to public health. I can't really. I'm like, there's so much.
Hey, that's a good answer, man. Like, I feel like a lot of public health people probably know of intersectionality, but actually being intentional with being like pursuing understanding of different cultures and seeking ways to collaborate with one another. I don't think this is y'all in the audience better listen up to this, man. Y'all gotta be intentional about that. This is not
Yeah,
random.
yeah. I just finished a paper this past semester. It was really cool. I wrote this health program for my health programming and evaluation class. I wrote this fully Spanish speaking type 2 diabetes mobile intervention paper, specifically as it relates to 45 to 60-year-olds in the San Fernando Valley. So here in California, the San Fernando Valley is a valley within like Southern California. It's part of Los Angeles County. But yeah, even like designing and building programs like that, I think is really important.
That's awesome, man. I that's a great answer, man. That's because at the end of the day, that's at the foundation of everything. You can't really have public health for the public with all these different intersections. Like intersectionality has to be at the center of public health. I love that answer. That's a very very good answer. I appreciate that.
Yeah, yeah,
All
yeah.
right, but let's get to the little fun part, or my favorite part of the segment, the little rapid fire questions. A
Yeah.
little bit of silly, a little bit of silliness.
Boom, boom, boom,
But
boom. Let's go.
you
Let's
ready
get it
for
done.
it? You ready for it? Bam,
I'm
boom,
ready. Wait,
bam.
wait, wait, wait,
All
wait.
right,
Actually, I'm not ready. I'm not ready.
you're not ready. You gotta get ready. It's too late. We're taking
Yeah.
off. All right,
Okay, wait, 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 wait. Okay, I'm ready. I'm ready. I'm ready.
all right. Deep breath. All right, all right, all right. So Jared, if you could choose one superpower to help you out with either a project or a public health uh, class you're taking as a part of your master's program, if you could pick one superpower to help you out with your public health work, what would it be and why?
Ooh, my superpower would be something related to like telekinesis or mind control, because these fingers they get a little tired once the coding starts happening. So if I could do it with my mind, it'd be even better.
That's
You know what I'm
nice.
saying?
You say you use it for the computer, not people.
Yeah, We can't, not too much on
Yeah,
everybody.
unethical, unethical.
A little unethical. I mean, maybe once in a while I might be like, okay, this person's walking really slow. I'm gonna have to move them out the way of my mind. But like other than that, I would be using it to do things that I feel like, especially like typing, like I code. I think, I'm really fortunate to be in a program that teaches SPSS, SAS, and Stata and R as like languages. If I could just learn to do those with my mind instead of my fingers, I'd be really happy.
Very fair, man. That's yeah. Shoot, even just writing essays can get tiresome sometimes. But
Dude,
that's a valid answer.
you're telling
That's a valid
me.
answer. Mm. All right. So the next question is, if you had to pick a celebrity to give, or I don't do a research presentation, like your thesis. Like if you had to give a thesis with a celebrity, who would it be and why for your
If
public
I
health
had to give
program?
a thesis with a celebrity and who would it be and why?
Yeah, you have to go
Mm,
through the whole process, like do the research, write up the
You know
thesis
what?
proposal, XYZ.
Off rip, the person that came to mind was Will Smith for some reason. Because, he's been in Men in Black. Like, he gotta have some type of intelligence, like, up here. You feel me? Like, he can't not be cooking most of the time. But a close second. Sorry, I don't know why I just said that. Will Smith is crazy. I don't know.
I mean, shoot,
A close second would be oh man, he just was on TV. Cat Williams. I feel like Cat
Cat.
Williams, good person. No, because Cat Williams, one thing, he doesn't lie. He doesn't tell lies, and he's really good at explaining things in detail. So
Hey,
shout out Cat, shout out Will Smith. Those are my only two
yeah,
off the bat.
that's fair. I mean, shoot, if you get Pursuit of Happiness, Will Smith, you could get a genius.
Yeah, yeah, right, right, right.
Yeah, but if it's Cat Williams, you might want to go over the script a few times with him. Make sure he doesn't say anything crazy, bro. You might. I mean, he's gonna keep it 100, but you might let
Nah,
something slip out. You know.
maybe my fault.
No, I like that answer.
Okay.
All right. So, we kind of since it's Men's Mental Health Month, you kind of already mentioned some of the stuff you like to do, like dancing and uh, like exercise. You said you used to play sports back in the day, but do you have a favorite kind of relaxation activity for your mental health? Just
Yeah, yeah, yeah.
for another men's mental health month. We gotta plug
For
that in.
sure. We know you gotta represent. We gotta represent. We gotta represent. Something I do. I like incense, so I actually. Oh man, they're here in my room. I would grab them, but I'm a little lazy. But I like lighting incense. I feel like it gets me really calm, and it just smells good. So I usually try to do an incense either like once a week or, living on the coast, we have the beautiful, wonderful thing called the beach. And California has many beaches. Don't get me wrong. Are they all great? Not really. Okay, I'm gonna be honest. Like, yeah, like
Yeah.
there's a few beaches that I feel like are really hit. Everyone else is kind of like low key chopped. Like,
What? No.
it's
Nah.
bad.
If you're
So,
saying that, you're spoiled over there on the West Coast. You better not come over to the East Coast if you're thinking about going to the beach, man. Your mental health's gonna be cooked. I went to the
dang.
beach the other day. It's rocky. I feel like I don't know if it's what it is, but it got a little funk to it too, man. I don't know what it is. It might
Dang,
just be the
that's
water,
tough.
but
That's really tough. I'm really sorry.
yeah.
Y'all got it. Y'all got it like that.
What does it smell like when you have the incense? What is it? What kind of scents do you like?
Oh, yeah, yeah, yeah. I get like the ash. Like, I don't know, like if it's like an ash or like a teak wood. Like sometimes, it smells really, really like very similar to cologne. I was gonna grab them, but I really can't grab them. But they're very similar to like cologne. I think something else that I like to do is hike. So I love nature. I love going outside into nature. I used to do this thing in undergrad. It was like a challenge I had for myself. It's called sunbathing every weekend. So I try to like go into specifically like within Orange County. They have some really nice like hiking trails where you can just kind of like sit, and there's these big redwood trees. And you can just chill. And so yeah, I would do that sometimes too. It's called like sunbathing. It's just a really, really good way of like getting your vitamin D up, but then also like, decreasing, low cortisol type.
Yeah.
Yeah, real low
Keep that
cortisol
low. Keep
right
that
here.
low.
Yeah, yes, sir. Yes,
Right.
sir.
Oh, that's awesome, man. And then my last question. It's a little controversial, but if you had to pick, I don't know, if you had the ability to turn off the mic for some of that you believe is kind of spewing bad discourse in the public health realm, whether it's online or wherever, who would you pick and why? Like, who could you, if you could mute
Who
someone's
to
mic, who
turn
would you
the
mute?
mic on?
Yeah,
Uh,
who are you putting on mute?
I think it's very obvious. RFK Jr. Like, I mean, no, I have not like. Oh, let me not get into it. Let me just say RFK Jr. That man is crazy. I don't know who gave him his degree. I don't know what type of like science he is reading or producing, but like he is making the idea of healthy people 2020 2030. He's making all those healthy people things go away. So I'm like, I think it's about time to put a little sensor on him, call it a day.
No more RK.
Yeah, no more RFK for real, bruh.
You are
But
officially muted, man. Put you on mute. All right, but with that being said, that kind of wraps up what we got going on, Jared. I just want to
okay,
say
cool.
thank you.
Yeah. I was just say real quick. Someone you should
Yeah.
turn the mic up on. Someone we should be turning the mic up on.
Yeah.
Dr. Michelle Williams. She is the previous dean of the Harvard T. Chan School of Public Health. She has wrote this amazing book, The Cure for Everything. It talks about the state of public health world like right now. This is someone who we should be turning the mic up on. We need to turn the mic up on her a lot more. This book is so good. I recommend to everybody if they get a chance to get their hands on a hard copy.
Shout out Michelle. Shout out Michelle. Y'all rep that book. I know I'm becoming a copy of that right there.
Yes, sir.
But hey, I just want to say thank you, Jared. Thank you so much. It was a pleasure.
Yeah, yeah, yeah,
Do
yeah.
you have any Instagram or any social media you want to plug before we wrap this up?
You can find me on LinkedIn. Please, for those of y'all who might have jobs in clinical research, you can find me on LinkedIn. I think my LinkedIn is just my name, Jared Brown. My Instagram is, or not my Instagram, but my, like, where you can find me on social medias very often is jared.brown. My name will usually pop up just immediately. And also, you can follow our dance team. It's called Baudelaire Dance. So if you know Tyler, the creator, and his like network, he does this thing like a clothing brand called Baudelaire. So our dance team is based off of Baudelaire. So if you just search up Baudelaire Dance, you'll find us. Yeah, shout out to my homie Spencer.
Shout out Baudelaire, man. I was gonna ask if that's from Tyler the Creator. I knew that he had a
Yeah,
song,
yeah,
but yo, shout out to them, man. Shout out Jared. Shout out Baudelaire. Shout out Tyler Creator. Shout out everyone. Shout out
yes,
Michelle
sir.
Williams. Yo, let's keep
Shout
it
out
going.
Nate. Shout out Nate for doing the damn
Hey,
thing,
hey,
for doing the
hey.
thing for us, for putting us on. Yes, sir.
Yes, sir. And just thank you to everyone in the audience too. Thank you to all my brothers and sisters in the audience for making it to the end. Like like this podcast whenever it gets posted. To stay tuned for more episodes, and please do give us a follow on LinkedIn, Brothers in Public Health. To stay tuned into all the projects we're working on, and if you're interested in joining the network, becoming a brother, check out our website, Bros www.brosinpublichealth.org to become a member or donate potentially. But with that being said, uh, stay. Any last words? Any final statements, Jared?
Stay safe out there, y'all. Don't allow the darkness of tomorrow to cloud your success that is waiting. Um, yeah, shout out, appreciate everybody that's in the Brothers Collective. Y'all will start getting. We're gonna get active in the Discord, so y'all got to start getting active in our Discord. Please, please, please run us up. Tap in.
That's what's up, Jared. Keep up the good work.
Yes, sir.
And with that being said, oh my fault. You said something?
I know. I said you too. You too.
No, I appreciate you, Jared. But with that being said, I hope you have a great night.
Thank
Much
you.
love.
Ooh.
Let me stop recording.